So my name is Jim Rosso, one of the course directors here with my good friend and colleague, Dr. Mark Lebwohl, and we've been doing this fall clinical dermatology together here in Vegas for 19 years now. And what do you think makes this meeting so special?
Well,
You've been at it for a while.
The quality of the speakers is always extraordinary, and we use a very specific formula to get the best speakers in our specialty. The topics that we select are the ones that are of most interest to our audience, and I think that everyone in the audience feels like they come to this meeting and literally the next day back at work, there are things that they've learned to do that they do differently and better because they were at the meeting.
What I think is really important is a lot of the people that speak at our meeting also speak at other meetings, but I feel strongly that we've developed a reputation that we really expect them to bring their ultra A game and really bring the latest information that's clinically relevant to the dermatologists and the practice.
I would say, a second part of that is that the speakers whom we invite are always at the cutting edge of the specialty. So for example, take this last weekend, there are medications that many of us never heard of that our speakers were aware of that are just beginning to enter the specialty and that are going to affect the way we practice in the next year. So for example, abrocitinib, I've been following JAK inhibitors for years, and literally in the last 2 weeks, and I'd heard the name, but didn't hear any data about it until this weekend. Phenomenal new, very selective JAK inhibitor. Several other JAK inhibitors presented here. Tapinarof, a new non-steroidal cream that's as good as very strong steroids. It's heard a little bit about it, but heard much more about it at this
In a different class of compound, a new class of non-steroidal mechanism.
And even, this heat device that I'd never heard of for treating warts was presented here. So all kinds of new things that some of them we're going to use tomorrow, literally tomorrow in the office. There are things I'm going to do differently, but also things that are coming in the next few months that we'll get ready for and we now know a lot about.
And the majority of these people are not only doing research, they're also seeing the patients in clinical practice, so they can provide both of those perspectives. We've also had here discussions of 2 drugs that are just recently FDA approved, one right before the meeting and one during the meeting. One is Trifarotene Acleaf Cream for acne. It's the first one that's ever been formally studied for truncal acne. Also studied for facial acne, a topical retinoid, and also the minocycline 4% foam, the MZEEQ, that's gotten approved for acne, actually got approved while information was being presented at this meeting, so that's very, very exciting.
Yeah, the phase 2 data for lebrikizumab, a very exciting new antibody for the treatment of atopic dermatitis, was released at this meeting for the first
time presented, yes.
And extraordinary data, and we're proud that it was released here, but more importantly, it's clinically important to our attendees. I know, I have patients who I'm treating with antibodies for atopic dermatitis who are doing okay, but could do better, or having side effects from that. And so here's a new one coming that I can say, okay, wait a little bit longer, we're going to have something for you.
Right, and there's many examples of that in other classes of drugs. Mark, it's always a pleasure to be here with you. I did learn a couple of things from you also at this meeting. I want you to know that.
Well, thank you very much.
Thank you.
Yeah, I learned a lot from you.
Okay, thank you.
Right,
we'll
thanks,
see you next
everybody.
year, hopefully.